Good afternoon, ladies and gentlemen. Our sincere apologies for the delay because the other members of the team are not here, but because you are here, we think we have to do something and discuss. I think you all know our topic is on sexual reproductive health for persons with disabilities. So that's our topic. And with me here, I will start introducing myself. My name is Beauty Nyamwanza. I'm the National Youth Coordinator with National AIDS Council, and I coordinate all the young people's programs in the national response, and I also coordinate the technical working group for COVID-19, SGB, VSRH, HIV and AIDS for persons with disabilities. So issues of persons with disabilities, I think, are the real issues we have to talk about. So my colleague will introduce himself and then we'll start our discussion. Thank you.
Thank you, my fellow orphan. We are basically orphaned because the chairs and panelists are not there. So we decided to respect your time and start a conversation. My name is Innocent Mudisautil. I work for UNFPA Regional Office for East and Southern Africa. And of course, issues of disability are issues of concern to our organization. So we'll share some reflections on that.
Thank you very much, my colleague. So I think the issues we really want to talk about are sexual reproductive health issues for persons with disabilities. So I think you agree with me that there's been a lot of talk on issues for persons with disabilities. We've had a lot of strategies, we've had a lot of plans, which always say, including persons with disabilities. So there's been a lot of talk, a lot of even written documents, but implementation and the resources which are set aside for persons with disabilities, indicators, if you look at even your programs, look at the indicators you are tracking. Do you have indicators disaggregated? Yes, gender, we have, but for what of persons with disability, what are their issues? It's just the mainstreaming. So I think it's very key for us, I think, in this forum to discuss on how best we can improve, especially if we are programming for persons with disabilities. So I think my take is that the first issue is we really have to identify those people with disabilities. When we identify them, we have to work with them to identify the other categories of persons with disabilities, because they also have different categories. So we really need to know who are the persons with disabilities and engage them and find out what are their issues, what do they need us to address on their issues. There are a lot of issues, like I rightly said, that in our plans, yes, we might mention it, but you find that we don't even have even the persons with disabilities themselves, or even a budget for persons with disabilities. So in this forum, we really want to see how we can improve programming for persons with disabilities. And even in this meeting, we don't have an interpreter for sign language. There could be someone who is hearing impaired who is here, and they are not hearing what I'm saying. So it's also just a talk show. Even here, we don't have something for hearing impaired people, for them to understand what is happening. So these are the key issues we really need to articulate and see how best we can improve programming for persons with disabilities. What issues should we have in our programs? Like I rightly said, first planning with them, identifying their issues, having budgets which are set for persons with disabilities, and have indicators which track what is happening, what do we plan this year to do, and what have we done. I think that will really improve our programming for persons with disabilities. And I would really want to excuse if we have people who are hearing impaired. they cannot even hear me because we don't have an interpreter here or for hearing impaired people who have sign language. So I think that could be my initial discussion, so that we will discuss together. Like we said, even the people who are supposed to be here are not here. Some of the persons who are here were persons with disabilities, but I don't know how they managed not to be here. So thank you very much. I'll give it to my colleague to take it from here before we open up the discussion to you. Thank you.
No, thank you very much. I think from my side, just few messages just to pass across. One, that from UNFPA, we consider issues of disability to be quite critical, because as you may be aware, according to the global data, 1 in 5 women, for instance, they have some disability of some sorts. However, when we look at the readiness of the social sector, including the health sector, the education sector, to actually address the needs of people with disability, we realize that it's actually not adequate. And one of the major challenges that we are aware that faces persons with disability is really around issues of sexual violence. We know, for instance, that persons with disabilities are 3 times more likely to experience physical sexual abuse compared to other women with no disability. We are also aware that women with disability are estimated to be up to 10 times more likely to experience sexual violence. So these are some of the challenges that persons with disability face. And another challenge is that when we look at our health services, they are not actually ready to provide services for persons with disability, especially for sexual and reproductive health. There is misconception in many of our countries, for instance, that if a person has disability, they are not expected to be sexually active. Hence, we never actually think about the kind of special services or differentiated services that we could actually deliver to this type of people. Similarly, our communication doesn't actually take into consideration people with disability. If you look at sexual and reproductive health communication, it assumes, first of all, that you can see, that you can read, and that you can actually go to the health facility. And also, if you look at our health facilities, the way they are structured, they assume a person who has no disability. In other words, they are not disability inclusive in terms of even access. So I think these are some of the challenges that makes persons with disability to have unique challenges when it comes to the issues of access to SRH, both in terms of information and in terms of services. As a result, then they are more likely to be vulnerable to issues such as HIV, unintended pregnancy, and also STIs. So I think we need to reflect and see how we actually involve them, first of all, in taking part on the appropriate information that needs to be delivered to them, and also in the services. I think another mistake that we make is to assume that persons with disabilities are uniform, whereas they are actually very divergent and unique. And so we need to be reflecting on the different uniqueness of the persons with disability and tailoring our services and information to that group of people without necessarily generalizing and putting them in the same block as if they have the same needs. For instance, somebody who has physical difficulties is different from somebody who has sight challenges or hearing challenges. So we cannot just assume that the solution that we offer for SRH and persons with disability will be the same. We need to be reflecting and programming and being precise. I think generally one of the concerns that we also have is that in many of our countries, even when you look at the census, we don't collect enough data to enable us to actually have disaggregated data on different persons with disabilities. So I think data is one of the areas that we need to be reflecting on so that it actually assists us as we plan for SRS to know even the geographical location for different persons with disabilities and also the type of disability so that we can table our needs appropriately. I think I'll end this far. And like my colleague said, in the absence of the chairs and other speakers and the organizers, we thought we should just start the conversation so that we can dialogue. So if colleagues have issues to add or ask, please feel free to show by raising your hands. So we are both sharing and speaking. Yes, I recognize the lady over there.
Thank you very much. I was really looking forward to this, and thank you so much for taking the initiative to go ahead with the session, regardless of the people that are absent. So my name is Kangwa Kasonde. I'm from Zambia. I work on the Dreams Initiative. So in my experience of having worked with young people for quite some time now, I identified a gap. There was a time I was working for an ART clinic just as my first job as a social worker. So I encountered a young lady who had a hearing impairment. So she tested positive, and then after the third, then we had not started the test and treat. So she was coming for her third adherence counseling session, and then she came to the social worker's office for us to assess her social, life, so that we see whether she was ready to start medication, she was in good space, but there was communication barrier. And there was a woman from her home space who was doing the interpretation. Now, it led me thinking, because we equally had to ask about questions on stigma. Is she facing any stigma at home? So if that girl was being stigmatized at home, definitely she said no, because there was an auntie who was interpreting. So that was a huge barrier. It led me thinking. And then later on, along the way, I joined Dreams. I encountered a number of girls with similar problems, maybe somebody with a hearing impairment or visually impaired. And it got me thinking, why don't I get more skills so that I'm better placed to equally, help people who have different disabilities. Now, coming to the point of what we need to do, what should we do? We have this problem. We are faced with a problem of we are delivering services, but they're not inclusive. They're not inclusive. So we have materials that are not tailored for people that have a visual impairment, for example. Are we putting our materials in Braille? Take, for instance, here at the conference, how many materials are in Braille? Okay, does it mean people that have visual impairment don't need to access those materials? So we are leaving a certain type of population behind. And then also, like I had taken note to say materials are not adapted, and they need to be adapted to suit the unique needs of the people that have various disabilities. And then also accessibility. He mentioned about accessibility in service points. Are those spaces accessible? Is the environment modified so that people can easily access those services? So those are things that we need to really take a look at. And equally, service providers, we have people coming from different organizations here, others from funders. Are the spaces, are the implementing organizations equally employing people that can easily talk to different persons with disabilities? So I think there's a huge gap, even when it comes to service provision. When a person with maybe a hearing impairment walks in, is there somebody who has a skill in sign language there in that service point. So there's a huge gap. I think there's a call also to capacity build as organizations. Maybe that's something that can be factored in the funding. I know funding is really tight, but I think those are things that we need to look into if we have to take along everybody. Thank you.
Thank you very much for sharing. Yes.
Thank you very much. My name is Patricia from Kenya. And I think one of the things I just want to note is that it's really sad that for such a great session like this, we miss out main speakers, chairs, and all that. It goes on to tell you how often Is it because of the speaker? Maybe let me stand here. Yeah, how often persons with disabilities are ignored and many times neglected because people tend to see them as very different. And so I just want to point out a number of things. For us as an organization, we do program for persons with disabilities. And some of the things that we have noted, number one, is aligned to the issue of data. And we all know that when you don't have data, nobody listens. It's like you're talking rumors. And it is very important that at various levels, some of the things that may come out as recommendations here is that we need to have surveys done or even studies and studies involving persons with disabilities so that we also just do not imagine the issues that they may be facing. We get to hear directly from the voices of persons with disabilities, sharing exactly what are some of the barriers that they do face. The other issue is language. And for language, again, being cognizant that largely for example, deaf persons, we have country-level sign language. So you find if you go to Kenya, it's the Kenya Sign Language. You go to the US, you have the US Sign Language. And then we now have the International Sign Language, which very few sign language interpreters have been, trained to be able to do it. So I think there's need for harmonization on sign language so that cuts across, and it really doesn't matter whether someone moves from one place to another, that there is a universal language that they can be able to understand. Again, for communication, we often tend to go with the majority and imagining that persons with disabilities are the minorities and so no budgets are put for them. What that means at the end of the day is that we are pushing them to the boundaries. They're already vulnerable, they're already marginalized, they're already stigmatized. And when we think about the intersectionalities where you meet a person with disability who is also a key population and is also living with HIV, and they have all this stigma that surrounds the various components of their lives. But really, when we get to see them, they are often summarized as someone with disability, and we have failed to address all the other needs that they have. My third point is on the fact that persons with disabilities miss in policies. We put them as a sweeping statement. It's like the third gender rule. Let's observe, let's have a third of persons with disabilities in policy areas, but we don't really include them and unpack exactly what we want done for persons with disabilities. And in our own countries, in our own ways, we need to start pushing for this because you will find, for example, our 8 strategic frameworks, we've just mentioned them. But there's actually nothing that is focused on persons with disabilities. Even for the HIV estimates that we have in our countries, we don't have specific numbers. We can quantify numbers of AGYWs, of key populations, but when you ask us persons with disabilities, we all keep quiet. We do estimates and we say probably 1% or 5%. These are people, we need them counted so that they can also be budgeted for. They have low levels of education. If your country is like mine, parents hide children with disabilities. They don't get to go to school. Look at all our communication. It's done in English, or it's done in French, or it's done in another national language, and we do expect them to read. and then do what we have said in those communication materials. So we need to ramp up the issue around education for persons with disabilities and have more schools that target them. Low self-esteem is also a major issue because of stigma and many other things being ignored and feeling like you really don't matter. We have persons with disabilities who can't speak for themselves. They know what the problem is. You go to them, you ask them the issues they are facing. They know them, but they're unable to communicate it to anyone. So I believe that just the same way we did with all the other populations that we felt were marginalized or vulnerable, they needed a platform. We need to start creating those platforms, and we don't go to persons with disabilities and tell them, if you don't create it, come to the table and start talking. They are not the kind that will do that. The same way we created platforms, let's start creating them for persons with disabilities so they can come, they can share, they can be able to speak about their issues that can be taken into consideration. And as I finish, there's been a lot of, language around how do we refer to specific populations. We now have the suggestion that can we start calling them persons who are enabled differently as a positive language, as opposed to just saying persons with disabilities. And I don't know whether there's a global consensus to start taking that direction with a language that is more empowering than the disempowering language of calling them persons with disabilities. Thank you.
Thank you very much. Yes, you can give the person next.
Yes, I think what I wanted to contribute is in line with what she has already spoken. But in as much as we consider the people with disability, it's long ago that these people with disabilities, they were considered as lunatics, and later on they were put into asylum. So it's up to us for us to protect them, and in as much as we are protecting them, we should also look at the placement options that is able to give them a skill and do basic skills. Thank you.
Thank you very much. We have someone at the back.
Thank you very much. My name is Rafik Satia, and I come from the Midlands State University. I'm also representing Say What. So I'm going to give an experience with regards to my institution, with how it deals with people who are living with disabilities. This year, on the 16th of June, on the Day of the African Child, we had a privilege of visiting the students who live with disabilities, and they have got what is known as a student resource center where they reside and where they've got facilities that are good for them. So it's a privilege that we have at our institutions, that we have platforms where the people living with disabilities are able to come together, and we as people also, we can visit them and we have social interactions. However, within the deliberations that we were having with them, one of the fundamental problems that they raised was the issue of accessibility. In as much as we talk about HR issues, specifically looking at condoms, that was one of the issues that they raised. Being disability doesn't mean inability. They are secluded in as much as condom distribution is concerned. So what were they saying? They were actually saying, why is it people, they don't come here and give us condoms? Why is it people, they don't come here and teach us on HIV and teach us on TB issues? So I felt like it's a gap that we have in the world, is a gap that we have in our institution, that we neglect or we put aside the people living with disabilities in as much as sexual activities as well as having safe sex is concerned. So moving forward, we need to be able to give information to the people who are living with disabilities. We also need to acknowledge the fact that some things that we think they don't do, they actually do those things, and they need our support and they need fundamental infrastructure, and we also need to give them the materials so that they can access them easily. I think that way we can talk about not leaving anyone behind in as much as the eradication of HIV and AIDS is concerned. Thank you.
Thank you very much for your contribution. I think just a bit, a correction a bit, it's, they don't live with disabilities, but they are persons with disabilities. Thank you. Any more contributions? Yes, at the back.
Thank you. My name is Judo Riopod from Uganda. I work for Population Services International Uganda. All of us here have someone somewhere we love and they are living with a disability. I remember in Uganda and across Africa, long ago, we used to think that decision making should only be for the men until movements came into place and said, let's have the women at the table. Let's decide together for them. We could follow the same in bringing the people with disability where we hear from them. It's different doing the planning, doing the programming for them when they are not there. So we can even start at the recruitment level, the different national governments, the different organizations, the guidelines or some kind of policy to ensure that we have someone who represents that team. For example, sign language, you can have an advert for your organization, but they cannot come, they cannot apply because there's no one at the reception to welcome them. So it goes beyond just us understanding that they have these problems, we need structural improvements, but can we start with what we have and have them at the table as we're making these decisions? Surely the recommendations from any implementation where the person is involved will have a direction towards improving the service delivery for that category. And yes, I agree with the previous speakers. Thank you.
Thank you very much. I think we just have one last contribution before we conclude because we're just left with a few minutes. Yes, that side. Go ahead.
All right, thank you. My name is Douglas. I'm from Zimbabwe. For me, as I'm seated here, I'm just thinking in terms of issues like assistive devices. Most of our programming here is HIV focused, and we see a lot of need in terms of assistive devices for the children with disabilities that we work with, or the persons with disabilities that we work with. And it seems as in terms of funding, no one is really out there to really go on national programs to fund assistive devices. We have a lot of children in the marginalized areas who do not even have any assistive device. If you come to big cities like Harare, you will see that a lot of children now have wheelchairs, hearing aids, spectacles, but if you go deep down the marginalized areas, those things are not there because the funding is not there to go there. So I wanted to pose a question to the panel, just to check in terms of what can we do to increase the funding, especially of assistive devices. We're talking of accessibility of information, but some people actually need an aid for them to be able to access the information. And the funding landscape that we're talking about here, mostly of HIV, does not really fund fully those kind of issues like funding assistive devices. So I just wanted to pose a question to say, what can we do so that we equalize and reduce the inequalities? Thank you.
Thank you very much for your question. Before my colleague concludes, I think on what we can do, that's why we are all here, so that we put our heads together from all the contributions and see how best we can improve the lives, sexual and reproductive health issues for persons with disabilities. I think what came from this fora is that there is a lot of exclusion for persons with disabilities. So let's walk the talk, I think, is what came from this session. And all the contributions, I think, which were made by people on the language we have to use, on budgeting for them, and also focusing on their needs and trying to identify them. Like Simon rightly said, that in most spaces, even in this country, there are families in the rural areas who just keep their young people or even old people with disabilities hidden because they think it's something which is not good to have a person with disabilities. You find even husbands leaving their wives because they have children with disabilities. So these are some of the issues. So I would like my colleague now to conclude because we are out of time. I thank you.
No, thank you very much. I think there's consensus in this meeting that indeed persons with disabilities are excluded, and that we need to reflect on how we can ensure that they are included. I think there's also an agreement that even the language that we use that emphasizes disability makes us be preoccupied with the negatives rather than the positive. So we need to rethink, have a mind shift on a language that actually recognizes that even though they may have such certain challenges, they have abilities in many other areas. So I think going forward, we need to be reflecting on that. I think we also agree that because of their special needs, they tend to be stigmatized in school. So some end up not actually going to school or not performing as they're supposed to. And we know that there's a correlation between SRH outcome and education. We have been talking in this conference that girls who actually proceed up to high school are likely to have more positive SRH outcomes than those that don't. And we know that the majority of persons with disabilities, they find it very difficult to actually proceed. We also know that persons with disability, they also have negative economic outcomes. If you look at poverty levels, the households that are headed by persons with disabilities tends to have lower economic level, which also has a correlation to SRH. Lastly, we know, as we have indicated, that they are actually vulnerable to many negative outcomes, including gender-based violence, including HIV, including unintended pregnancy. So I think it's really upon all of us to actually reflect and ensure that we influence our policies to be inclusive. We influence our education sector to be inclusive. We influence our health sector, specifically the SRH, to also be inclusive, and general welfare, even our legal system, to be inclusive with persons with disabilities. We thank you very much for your attendance, and hopefully in future there will be better sessions with all the concerned speakers. Thank you very much.